Hello, can you tell me your name and date of birth?
Hello Kitty. March 39th, 1802.
Okay, and what are you doing here today, Hello Kitty?
Face, neck, and mouth check.
Okay, my name is Tabby Erlinson, and I'm a student nurse midwife, and I will be performing your head, neck, and mouth assessment today, okay? Okay, let's get started. Hand hygiene. So first I'm going to be inspecting your scalp and your hair distribution, which is even, okay? And I'm going to be using my fingers to assess your scalp. I'm checking for any protrusions, lumps, bumps, pain, any tenderness when I'm touching you, Hello Kitty?
No.
Okay, excellent. And then I'm going to be assessing the temporal artery, okay? So I'm going to be pressing right above the zygomatic bone here. It's even, excellent. And then the next thing I'll be doing is checking the temporomandibular joint, okay? Open and close your mouth, please. Any pain or tenderness with that? Good, okay. The next thing I'm going to be doing is inspecting the facial expression. Her facial expression is very appropriate today. Her facial features are very symmetrical, including her eyebrows and the sides of her mouth, her nasolabial folds. I'm a little tired today. And then I'm also going to be assessing for any tics or tremors, lesions or swelling on the face. The only thing that I'm noticing here is some acne. Can you face the camera for a second? Thank you. Otherwise, everything else seems normal. Her head is normocephalic. And we will continue on, okay? So the next thing we're going to check is your throat, okay? And I'm going to be checking, just make sure the head is sitting on that neck midline. It's very still. Your trachea is midline here. I'm going to be checking the sternal notch, just to make sure both sides is equal and symmetrical, which it is. I'm also going to be checking for range of motion. So I would like you to move your head only by looking to the left and looking to the right, and move your head down and back. And then finally bring your ear to shoulder, ear to shoulder. And I'm looking for any limitation with that, or any tenderness when you're moving, any pain when you're moving your head like that. Okay, excellent. The next thing I'm going to be looking for or assessing is the lymph nodes. So I'm going to be gently using my finger pads in a circular motion, feeling the lymph nodes. There are 10 of them. So this is the preauricular, the posterior auricular, the occipital, the submental, the submandibular, the jugular digastric, the deep cervical, the superficial cervical, and the supraclavicle. Can you hunch your shoulders for me? Excellent. Okay. And then I'm going to be checking your thyroid gland, okay? So, I'm just getting your hair out of the way for a second, okay? So I would like you to face the camera here, and I'm gonna go behind you, okay? So I would like you to tip your head back, and then I would like you to swallow. And then with this, you see the thyroid move and then go back to place. And then I'm gonna go behind Lucy here and put my fingers on either side of the trachea.
You mean Hello Kitty?
Oh, Hello Kitty. Sorry. And
Lucy's my great-great-great-grandmother.
Lucy's her great-great-grandmother. So I'm going behind Hello Kitty here, and I'm going to have her actually stand up nice and straight and put her head forward. Very good. And then I'm going to press her trachea to the right and just kind of assess on this right side. and I don't feel any enlargement. And if I did feel enlargement, then I would assess with auscultation to see if there's a bruit present, which would indicate that there is hyperplasia of the thyroid. Okay. Next thing, I'm gonna look at your nose, mouth, and throat. Okay. Okay. So I'm looking at the external nose, making sure it's proportionate, it's midline, it's symmetrical. Okay, I'm looking for any lesions on the nose. Okay, and then I'm going to check for patency. So I'm going to press on one side, and I want you to sniff. And there's no obstruction. Good, awesome. Okay, and then I'm going to look inside her nose. I do not have an otoscope for this, so I am going to be creative and use this little wand. So I'd like you to kind of face towards the camera. Hello, Kitty. So I would, if I had an otoscope, then I would gently press in and not be careful not to hit the septum. But I'm going to just use my hand and then look in. I'm going to look at the nasal mucosa, making sure it's red, it's not bleeding, there's no foreign bodies present, there's no edema. I'm looking at the septum to make sure that it's midline, which it is. And then I'm looking at the turbinates, making sure that they're intact, they're not bleeding, there's no polyps. Okay, you can put your head down to normal position. Good job, thank you. And then I am going to palpate the sinuses. Okay, so gently I'm going to use my finger pads. I want you to tell me if you have any pain with this touch, okay? So I'm going to just below the eyebrow here, I'm pressing upward. Okay, that is normal. And then I'm going below the cheekbone, pressing upward. Any tenderness, pain here? Okay, good. Okay. The next thing I'm going to be assessing is the lips. And she does have a little bit of chappedness in her lips, but it's uniform color throughout, and it's symmetrical, and there's no swelling in her lips. I'm going to be pulling it down. Just relax your jaw a little bit so I can pull down. Okay, excellent. And then I'm looking at the top one under here. There's a little bit of tenderness. Hello Kitty just get braces done, so she just has a little bit of tenderness around the area. Let's see. Then I'm going to look at her gums. I'm going to use this tongue depressor to just kind of look inside here, okay? And her gums, her gum line is nice and pink on top and bottom. And it's well defined on the borders of the teeth. She does have all teeth present. She does have braces. The buccal mucosa is intact on this side. There's no lesions present. But on this side, it does look like this buccal mucosa was irritated by the braces, but you cannot see. But I can see it. Okay. Then I'm going to check the tongue. Can you stick your tongue out for us, Lucy? Okay, so it's nice and pink. It's a little rough on top. Lift your tongue for us. Okay, so this saliva is present. It's smooth on the ventral side. And then stick your tongue out, and I'm going to use this tongue depressor to kind of look at the sides of the tongue here. And actually, I'm going to use a glove and some gauze to assess the tongue. You okay? Okay. So I'm just gonna hold gently here while I'm looking at it. I'm sorry. It's a little uncomfortable. So there's no lesions present. Okay. And then, let's see, I'm gonna look at the uvula. Can you stick your tongue out for me? So the uvula is there and it's midline. Good, thank you. You just had to stick it out a little bit further, and I would like you to stick your tongue out and say ah. Okay, so the uvula does move up with that soft palate, and when she was able to stick her tongue out nice and as far as she could go. I could see the hard palate and it's intact. It is white and rugated, and in the back that soft palate is pink and it's glistening and it's movable. And then I also taking a look at those tonsils. They're about grade 2, but it's pink and it looks no white patches or pain. Any pain with that? Okay, excellent. Okay, do you have any questions for me?
No.
Okay, thank you so much, Hello Kitty.